Before I begin my presentation, I would like to introduce myself. My name is Cindy Lediana. I am a nursing student from Aisyah University of Yogyakarta. Today, I would like to presentation about pain assessment and management in Swedish neonatal intensive care units. And my presentation is divided in four main sections. First, aims from pain assessment and management neonatal intensive care units. And second, it's about methods. Third, it's about result. And the last is discussion and conclusion. Okay, before we enter the main section, I will explain the introduction about pain assessment and management neonatal intensive care. Pharmacological pain management also involves risk of adverse effect, especially in the neonatal population. Pain management in this vulnerable group requires a careful balance between effective pain relief and avoiding the negative consequence of pharmacological treatment, which is a challenge for caregivers. Negative effect from pharmacological treatment can include, for example, respiratory depression or neurotoxicity. Regular pain assessments are considered the basis for adequate pain management among newborn. Pain assessment instruments are increasingly available at Scandinavian neonatal intensive care units but are still not used clinically to the recommended extent. Okay, now we enter the main section, and the first is the aim from assessment and management neonatal intensive care units. Is to investigate registered nurses and physicians' knowledge, attitude, and experience regarding assessing and managing pain in infants at 7 Level 3 neonatal intensive care units in Sweden. And a second is about the methods. The research design from the method is the descriptive and explorative study using an online questionnaire. And the methods is a researcher developed online questionnaire with 34 items about knowledge, attitudes, and experience regarding pain assessment and management was emailed to 306 registered nurses and 79 physicians working at 7 neonatal intensive care units in Sweden. The third is the result. Okay, you can see of table number 1. This is one of the assessment table for staff characteristics that respond to pain assessment guidelines. And the result is most neonatal intensive care units had pain assessment guidelines, but there was discrepancy regarding interprofessional discussion of pain assessment. A total of 7 different pain assessment instruments were reported from the include neonatal intensive care units, and registered nurses were reportedly those who usually perform the pain assessment. Most respondents expressed a positive attitude toward pain assessment but recognized a lack of intervention after the assessment. 46% of the physicians said they had sufficient knowledge of assessing pain using pain assessment instrument versus 75% of the registered nurses difficulties assessing pain in the certain population of infant, such as the most premature infant and infant receiving sedative medicine were recognized. And the last is the discussion and conclusion. The discussion is, this study we found that registered nurses and physicians from mass neonatal intensive care units report having guidelines for pain assessment and management, and the most respond express and positive attitude toward pain assessment but recognize a lack for intervention after the pain assessment. And the conclusion is registered nurses in the study reported their pain assessment did not lead to appropriate pain management intervention. They were thus discouraged from further pain assessment or advocating for ethical pain management. And interprofessional team effort is needed to effectively assess, manage pain in neonates. That is all my presentation. Thanks for watching and wassalamualaikum warahmatullahi wabarakatuh.